everybody. I'm going to start. I'm Nancy LeBeau. I am the founder of Alumni in Recovery, which is an organization that joins the recovery community and the grieving community and the community at large to speak openly about addiction. We connect with communities and we wish to keep ending the stigma of addiction. One day at a time, we're doing it. And this is a very dear to our heart program, Heart at Work. And we call it that because the officers within Bergen County and everywhere in our nation have been working tirelessly and endlessly and for close to 2 decades now, responding constantly to overdose deaths. In Bergen County especially, they're the first ones on the scene primarily. And they have a lot to tend to and deal with, and they provide a lot of resources as well. And they care deeply for the community, and I've had the opportunity and pleasure of working with many of them. I had been an EMT in my town, Old Tapan, and I got to work with them firsthand, and they were always first on the scene. The thing is with addiction, and most of us already know that from April 2020 to April 2021 in our nation, that over 100,000 people had died of an overdose death. And that's not counting the Narcan administration saves, which probably would have been triple that had we not had Narcan naloxone on the scene. I think one of our primary goals is to ensure that we create connections with each other, that we find ways to keep the conversation going. Working as a nurse in addiction and being in recovery myself, one thing I know is true. First, 2 things. First of all, listening to other people's stories helps connect us. It connects us at the heart. It is the language of the heart to hear somebody else authentically speak to you. And secondly, that this disease wants us to isolate. It doesn't want us to talk about it. And we're, our nation has done we haven't been talking about it enough. So here we are, we have a platform and we're able to talk about this openly tonight. And the prosecutor has been very generous with his time. And I must say, working with the prosecutor's office, ever since we started Alumni in Recovery 7 years ago, I've seen nothing but open door, how can we help, solution-oriented officers. And they have so many other things that they have to focus on as well. But this always seems to be a top priority to them. And they never cease to hesitate to be of assistance. And they're helping with this presentation. And we will continue to do these presentations because it's so important to listen to our police officers. So with that, I will give you Prosecutor Musella.
Thank you, Nancy. Thank you for having me tonight. I want to welcome everyone for being here tonight. I want to thank Nancy. I want to thank Morgan Kennedy, and I want to, of course, thank Alumni in Recovery for organizing tonight's event and for having me here. At the outset, I just want to thank you, Nancy, for all your hard work in this area, for your commitment, your passion, your tireless efforts. And I really got to say, you're an inspiration, and you've inspired me and really, I think, all the police officers in Bergen County that are battling this crisis every day. So thank you for everything you do, Nancy. And this event and this platform, I think it's really important. I think it's important to recognize our police officers for the hard work that they do every day in this area. And again, I want to thank you for hosting this event and organizing this event, which I guess now has become like a monthly event. And I think it's needed, and I think it's a great idea. So thank you. It's a pleasure to be here tonight because, again, I get to thank the men and women in Bergen County Law Enforcement for being the innovators that they are, for being the role models that they are, and for being the public servants that they are. And and just for their response to fighting this opioid crisis every day that has taken so many lives in New Jersey and across the country and in Bergen County. So, I want to talk a little bit tonight about the opioid crisis, and I want to talk to you a little bit about what we're doing here in Bergen County and our response to this crisis, which I believe is saving lives. Last year, drug overdoses killed more people in the United States than car accidents, the flu, and gun accidents and gun incidents. For the first time, the CDC announced that drug overdose deaths surpassed 100,000 persons in 2021. Important to note, however, is that there were 4 states that did not see an increase in the number of fatal overdoses, and I'm happy to say that New Jersey was one of them. So I believe the things that we're doing here in New Jersey, and particularly here in Bergen County, are working and are saving lives. And I believe that this is the result of the forward thinking through the partnerships that we've established and through the initiatives that we have established in the Bergen County Prosecutor's Office and my predecessors have established, because many of them are driven by the law enforcement officers in Bergen County and in New Jersey. So I want to talk about 3 things tonight that we're doing here in Bergen County and that I believe is working. And the 3 things that I talk about when I talk about the opioid crisis is our efforts in prevention, our efforts in connection, and our efforts in diversion. So with regard to prevention, many of you know that the detectives in the Bergen County Prosecutor's Office are busy every day, and the Bergen County Narcotics Task Force in particular is busy every day intercepting drugs on the Bergen County roads and highways and throughout Bergen County, but they're also in the Bergen County schools. We are in the classrooms every Friday talking about our Pathway to Addiction program. Our detectives speak to 7th and 8th graders and 9th graders every Friday, and we have been doing this for more than 6 years. And in this presentation, the detectives talk about the 2 main pathways that we have seen that lead to opioid abuse and addiction, and that is opioid prescription after a sports injury or some type of medical procedure like a wisdom teeth removal, or we talk about the other pathway, which is experimentation with substances like alcohol, marijuana, and pills. We have also partnered with the Bergen County Utilities Authority for their quarterly recycling event. We encourage all Bergen County residents to clean out their unused and expired medicines and dispose of them during one of these events. And we also ask that residents of Bergen County bring their expired prescriptions to their local police departments that have drop boxes. We need to be more mindful of the dangerous drugs in our medicine cabinets, and we need to dispose of them and discard them periodically. Second, I want to talk to you tonight about connection. Police officers in Bergen County play an important role in connecting individuals that are struggling with addiction and connecting them to recovery. Since 2014, all police officers in Bergen County have carried Narcan. Last year alone, they deployed Narcan 362 times. That's almost every day. There were almost 700 overdoses in Bergen County last year, and 136 of them were fatal, but that is down from 10 overdose deaths in 2020. But we just don't track the numbers. We also connect these individuals, anyone that has been saved, to a peer recovery specialist. For the past 4 years after a Narcan deployment, officers call a recovery specialist to come to the hospital where the person is taking. And these phone calls are just one of the many ways that officers in Bergen County are creating opportunities for treatment and recovery. Police officers also offer anyone arrested for possession or other low-level drug offenses an opportunity to speak with a peer recovery specialist. And in a few minutes, you're going to hear from Mike Paoello from Bergen Newbridge Medical Center, and he will talk to you about our partnership on Operation Helping Hand. During Operation Helping Hand, the peer recovery specialists sit in our headquarters and meet with those arrested and talk to them about treatment. So as you can see, we are using every interaction with law enforcement as a connection opportunity. Third and finally, I want to talk to you about diversion. Prior to COVID, we began a pilot program, pilot diversion program in the Fairlawn Municipal Court that we call the Fairlawn Initiative. And that program allowed individuals suffering from drug addiction to work with peer recovery specialists and patient navigators and to get the appropriate level of treatment that they needed. Those who remained in compliance with their recovery plan were able to have their charges dismissed after 6 months. So it was sort of a municipal court, drug court, if you will. The COVID pandemic has disrupted municipal court, as many of you know, and so it has disrupted the pilot program, but we hope to eventually have that program up and running again and to expand this program, which we believe has been enormously successful, and make it a county-wide model. So those are some of the things that we are doing here in Bergen County to combat the opioid crisis. And again, I believe that they are working, and I believe that we are saving lives. Your efforts are saving lives. In conclusion, I want to thank our numerous partners in these efforts that I have mentioned. I want to thank the County Office of Alcohol and Drug Dependency. I want to thank the Center for Alcohol and Drug Resources. I want to thank Bergen Newbridge Medical Center. I want to thank the Black Poster Project, and I want to thank Nancy LeBeau and Alumni in Recovery. And there's many more partners that are working with us, and I want to just keep these partnerships going because I believe in this work. I believe in the work that you are doing, and I can't thank you enough for your efforts every day. And it is my privilege again to be here tonight and to thank everyone in law enforcement that is fighting this good fight. And I want to thank all the 3,000 law enforcement officers, men and women in Bergen County for your sacrifice and your service every day. Thank you. Nancy, thank you.
Thank you, Prosecutor Musella. That was awesome. And I love how you just constantly talk about partnership. And it's, again, I wanted, okay, yes, partners. I once again want to just emphasize how important it is that to recover from addiction as somebody that's been affected, we need to have like this repetitiveness of talking about it and keeping this disease process in the forefronts of our mind, just to cast light on it, you know. And we need to be mindful on a constant basis on our behaviors around substances and what we're modeling for our children. And it's time, you know, there just needs to be a big shift due to the opioid epidemic. So just like how during COVID, you know, the governor was on every day talking about the preventative measures around COVID, here we are just trying to create awareness on how we can prevent and help save lives through our officers and our resources, which leads me to Officer Alex Helmer, who I have the wonderful opportunity of having gotten to work with through Alumni in Recovery for a number of years. He's just constantly extremely passionate about helping others. And he has Alumni in Recovery come in when it's not, you know, when it's allowed because of COVID, to speak alongside their Not Even Once program for 2 full days. But what I want to really remark about is that all the officers are in the room. They're all participating in this, and they all have a care to listen to each and every person that speaks. And just what a bridge. Those bridges are so important. So I want to turn it over to Officer Alex Helmer. Thank you.
Right. That's going to be a really tough act to follow. That was an excellent opening speech by Prosecutor Musella. But first off, like Prosecutor Musella, I just want to thank you, Nancy, for allowing me to partake in tonight's event. It's really a tremendous honor to be part of such a great cause, to be representing my department, the Allendale Police Department, and also to be speaking on behalf of all of law enforcement about the kinds of things that we're doing to combat this ongoing opioid crisis. I'm going to try to avoid the redundancy and re-highlighting everything that Prosecutor Musella talked about. Like he said, there's so many countywide programs and initiatives that are in place now, such as the drop boxes and the Pathway to Addiction program. And we're just continuing to build these partnerships with recovery services such as AIR and others, and medical professionals and law enforcement agencies all over the county. I think it's really starting to come together, and you're starting to see it pay its dividends. So, with that being said, there's still so much work to do. I think, we're just cracking the tip of the iceberg, but, we're on a good path. And, I myself am just completely humbled to be here tonight. Like I said, just a star-studded cast for a panel, and there's some serious rank here. So just me being a patrolman, it's absolutely humbling for me to be here, and I'm honored. So just a little bit about me as a formal introduction. I'm Officer Alexander Helmer with the Allendale Police Department. I currently sit at the rank of patrolman, and I'm in my 6th year of service as a law enforcement officer. As far as my credentials go, I'm lead instructor certified. For those of you who are unfamiliar with it's the new DARE program that we run here as law enforcement. It's administered to 5th grade students in our middle school. I've been lead instructor certified for 2 years now, and I've had the opportunity to teach a couple classes. So I'm really kind of just starting to get my feet wet, but I'm excited to continue that work. I have an employment background in education as well. Prior to my career in law enforcement, I actually worked for 2 years as a teacher aide at the Chancellor Academy in Pompton Plains, New Jersey. And for those of you who don't know anything about Chancellor, it's a private therapeutic school, and it serves grades 5 through 12. And it's an institution that's geared towards students with behavioral disorders, learning disabilities, and a variety of other special needs. But one of the more common ones, and one of the ones that's most relevant to this discussion tonight, being substance abuse and recovery. So the main reason for me mentioning my role as an educator prior to my 5+ years in law enforcement is because now at this point in my life, I've seen the effects and the consequences of drug addiction from a variety of different angles. Not only on a professional level as an educator and as a police officer, but also on a personal level. And to me, that's the level that really hits home because I don't think you truly see the magnitude of the impact that drugs, especially opioids, have until you've seen what they've done to someone that's near and dear to you. Someone that you really care about, and someone that you knew before they went down a path of drug addiction. Whether that person's a work associate, someone who's a very close friend since childhood, or most importantly, a family member. I think I can attest that most people, if not everyone that's logged onto this call right now, has been personally touched in one way or another by drug addiction, because they know someone who's now in the stage of recovery, still currently going through the struggle of addiction, or worst case scenario, someone who's succumbed as a result of their addiction and their substance abuse. And I think that really goes to show how vast and how far-reaching the effects of opioids and other drugs are, not only for the users themselves, but for their expanded network of loved ones as well. So having said all of that, this disease of opioid addiction is especially dangerous because it does not discriminate. no particular race, ethnicity, socioeconomic status, or community type is immune from this, and the statistics prove that. Make no mistake that this is really a nationwide epidemic, and New Jersey happens to be one of the epicenters. Furthermore, pinpointing the crisis, opioid overdoses and deaths are just as prevalent in Bergen County as they are in any other area of the state. So it just goes to show how serious this is, and it's right in our backyards. It's going to take a concerted effort and a team-oriented approach to tackle this crisis head-on with full force. And I truly believe that you need professionals from all different disciplines that are contributing constantly. That's law enforcement officers like myself, school educators, social workers, healthcare practitioners, recovery specialists and recovery services such as AIR, and all other types of community stakeholders. Everybody really just needs to come together and share their knowledge, their experiences, and their ideas with one another. And I think, only then can you effectively spread awareness and take action in confronting this crisis in communities across the country. And, as I stated before, I think we're getting there. I think, everything that we're doing as a county is right on spot. And, we just have to continue that great work and, keep up our efforts. So just a little bit about what we're specifically doing as a department here at APD. I'll start with this. Several years ago, the Manchester Township Police Department down in Ocean County, New Jersey, pioneered their own opioid awareness initiative, and that's called Not Even Once. Not Even Once is a 1-week curriculum that's intended to be taught to junior students in high school, and that's with the premise that a student halfway through high school is kind of right around that age when someone is likely to be first exposed to opioids. So we actually sent our officers down to Manchester for they call it a train the trainer seminar that they held. And we got really just an in-depth look at how the program was designed and how it was meant to be implemented. So we took that training and used Manchester's PowerPoint as sort of our own boilerplate. And we developed our own version of Not Even Once. And that program is also administered to junior students at our very own Northern Highlands Regional High School. For those of you that don't know a lot about Highlands, it's a regional high school, and it serves students from 3 different towns, from our own town, Allendale, Saddle River, and Hurtuk. So this program is far-reaching. It's a great educational institution for it to be held, and we really can't wait to continue it in the years going forward. So just going back to the program, we took the training that we had down in Manchester, and we used like I said, we used their PowerPoint, we've been giving the program or administering the program to our students for 2 years now. We're coming up on our 3rd year of our own Not Even Once, and I can honestly say that it's been an amazing success. We've got nothing but positive feedback from the school's administrators, the school's teachers and students, and we've even actually gotten a couple emails and calls from the students' parents. So you could definitely tell that the message about the risks, the effects, and the consequences of opioids is being effectively delivered, and the awareness is definitely being raised. A little bit more in depth, just about the program and how it runs. Like I said before, it centers around that PowerPoint presentation that we kind of ripped off of Manchester Police Department. But it also incorporates classroom instruction and testimonials given by Allendale police officers. There's also a strong emphasis on officer-student interaction. Students are presented with questions and given surveys throughout the week to promote classroom participation. And that's a great part because it really keeps the students thinking and engaged and involved in the program. I think one of the most unique parts of our program personally And by far the standout highlight is our guest speaker portion, which runs 2 out of the 5 days in between our classroom instruction. And while planning the inaugural curriculum, I was fortunate enough to be connected with Nancy and members of her organization, Alumni in Recovery. And since that time, we have gratefully taken advantage of their services in visiting our school during our program to give their presentations. Their real life accounts are extremely powerful and compelling, and their stories provide yet another perspective on the opioid crisis. But I think it's particularly valuable because it's, this time it's coming from those who have actually experienced the struggles and challenges of addiction firsthand. Having them there and watching them captivate and really just mesmerize our students for an entire day while they speak about their own personalized experiences. It not only gives officers a much needed break from the classroom instruction, but it's truly an incredible thing to witness. And, they're really just an invaluable resource to have at our disposal. I'm not even being dramatic either. That's really the effect that they have on our students. And it's kind of just, like the home run of our entire program. So unfortunately, the curriculum for last year was canceled due to COVID restrictions and was postponed again this year for the same reason. But we've been in contact with the high school trying to work out dates, and we feel confident that we're going to be able to reschedule sometime in the spring, hopefully either in late April or early May. So we're really excited to get back on track. And, like I said, that's our own department's initiative in what we're doing to really confront this thing and make a difference. And I think that's all I have. Thank you for letting me have the stage for a little bit. Like I said, I'm honored to be here. This is an incredible cause, and I'm really excited to be a part of it.
Oh, I'm excited that you're here too. We all are. Thank you so much, Alex. That was really well done. And we'll looking forward to getting back into Northern Highlands. So thank you. Thanks.
Absolutely.
I am so happy that I get to introduce Westwood. Westwood Police Department and the town of Westwood has been really good to open their doors to our services. Alumni in Recovery has had the opportunity of having community-based events within the town. And the police have been nothing but open about like talking at our different events. We had our first walk in 2019 before the pandemic. In Westvale Park, a walk to remember. And at that time, the police, it was Deputy Chief Jay Hutchinson at the time spoke at that, and we thank him. And the chief has spoken as well. And I know they have a lot of you have to say. So I'm going to turn it over to Lieutenant John Hurtuk.
Thank you, Nancy. Yeah, we were supposed to meet last week, but unfortunately, the whole family here got COVID. But we're all doing well now, so that's a good thing. It's an honor to talk tonight. I just want to go over a couple of programs that the Westwood Police Department has in regards to outreach programs. I'll introduce myself. My name is Lieutenant John Hurtuk from the Westwood Police Department. I've been in law enforcement for approximately 18 years now. I did a year in corrections. I did 4 years in Irvington Police Department before I moved up to Westwood Police Department. Recently was promoted last year. And it was definitely an honor. Like everybody else said, addiction can happen to anybody. I mean, I know myself, a family member of mine had an addiction problem. A lot of my family members looked up to me because I was in law enforcement to help him out. He went in and out of rehab. I actually stayed with him for a little bit away from my family to help him out, and I can say that he's doing good right now. A little bit about the department. Last year, we had approximately 5 occasions where we administered Narcan, and that was 5 individual lives we were able to save. In Westwood, we have every officer equipped with Narcan. So it's not, just one person in town, it's every person has it. So if something happens in their sector, they're there first and they can administer it without wasting time waiting for the other officer. The officer said that, it's pretty simple to use, never had any issues. And again, we saved 5 individual lives there. A part of our proactive approach to addiction, we actually participate in the Helping Hands program from the Bergen County Prosecutor's Office. Here in Westwood, what we like to do is we don't like to send detectives. We actually send the patrol officers because those are the people that are going to be dealing with it. So it's a good program. I'm going to go over it briefly. It's basically like, initiative to go out and arrest people for a controlled dangerous substance. And then once they're arrested during the process, they're able to speak to an addiction specialist. And when they speak to that addictions specialist, they have the opportunity to get treatment right away. And our patrol officers, when they're down there, they're networking, they're getting contacts so they can bring it back. And I know 2 officers in particular that told me that, when they arrested somebody, they actually gave them a contact information. They never really followed up, but instead of just, arresting somebody, giving them a court date and never seeing them again, we're really trying to help treat the problem. We know that, we can't arrest our way out of this. Another program I was involved in when I ran the detective bureau, we had the Project Medicine Box, where basically it's a life-size mailbox in our lobby. And anybody from the community or outside the community can drop off their unused medications. That's been a big success. When I was in charge of it, I know I've had to empty that thing out at least twice a month, and we dispose of it properly. We also continue to have good relations with the Bergen County Prosecutor's Office, and we actually put one of our detectives on loan there. And before I spoke tonight, I called him and I asked him, I said, you have anything to add? And he said, down there for a year, he learned a lot about investigations, but the main thing he brought back was how to treat people after the arrest and get them treatment. Because he said, you see the same players over and over again. So we need something to have, a treatment as opposed to like, oh, here's your court date, we'll see you in a month. So he, every time he works, when there's an arrest, he'll come speak to that individual, or sometimes he'll actually come in on his days off just to speak to somebody if an officer requests it. We have another lieutenant. His name is Lieutenant Foley, and he is in charge of our HART program. He's a representative, and he also works with Bergen County Prosecutor's Office. Another thing we like to do is education, and we have a leads officer. It's Officer Danielle Newberger, and she is just a phenomenal officer. It's like her passion. So it was so easy to put her in the schools. And again, I talked to her prior to speaking tonight, and she told me, in 4th grade they learn about peer pressure. Nothing about drugs, just about peer pressure. And she said, that's a great program to have. And then when they go on to 8th grade, she told me that they learn about addiction, and they also learn about street drugs. And she said, when these kids get older, say they're in high school and they have a problem, it's easier to talk to her because she has a personal relationship with some of her students, and it's just great. Like she said recently, one of her students' fathers had an issue, and actually reached out to her, and she reached out to Lieutenant Foley, and they helped that family member out. The last thing I'd like to talk about, I guess, is our partnerships with you guys, our partnerships with other rehab facilities in Bergen County, and also our partnerships with our local government. We have a phenomenal police liaison, Councilwoman Collins. She is great. She's the type of person that will come to one of our events, not just say hi. She'll be there for hours, and she talks to every officer. She brings her family. Just a really nice person. And recently she had us get involved in the pizza positivity. I know I was gonna mess that up, but yeah, that was a great program. I mean, every officer in our department was eager to get involved. Councilman Collins also went when we delivered the pizzas to the hospital just to drop them off. She actually brought her daughters. Again, like, I think partnerships and networking is a big part of this, and that's the only way we're going to overcome this. Like I said before, we're not going to arrest the way out of this problem, and we know that in Westwood. Unfortunately, the chief couldn't be here tonight, but again, it was just an honor for me to speak a little about the program. I definitely want to get more involved. I know Lieutenant Foley is our heart program. He knows a little more what this entails, but again, just an honor to be here, and thank you for having me.
Oh, thank you so much. That was great. And it's a good thing you mentioned Councilwoman Erin Collins, because she's here and she was just going to say a couple words. She's at a basketball game for her daughter, but are you there, Erin?
Yes, I'm here. I'm standing outside. Can you hear me?
Yes.
Okay.
Hi.
Hi, everyone. Thank you, Lieutenant Hurtuk. That was wonderful. Yeah, I just wanted to actually speak about the Pizza Positivity Initiative. And so the Westwood Department participated in the initiative on August 9th, 2021 at Bergen Newbridge Medical Center and Paramus. And the department worked with Kristen Verrier to coordinate the delivery of well wishes and inspirational messages and pizzas prepared by Savino's Pizza and Paramus. We had many officers participate in the delivery of the pizzas, as well as create the cards and messages for the individuals participating in the program at Bergen Newbridge Medical Center. I would like to especially thank Officers Chris Horst, Sean Roche, Lieutenants Antonacci, and as well as Deputy Chief Hutchinson. The Pasco Press ran an article about the department's involvements in this worthwhile initiative, and I thought it was extremely important to show our department in a positive and supportive light towards individuals seeking treatment and recovery. Lastly, I would like to mention how proud I am to be the borough's liaison to the department this year and last year. I've been able to view the day-to-day operations of the department that the layperson would normally not be able to witness. And many of our officers really do go above and beyond for our residents and check in on them and their families after an incident may have occurred. So they have been really encouraging and welcoming to individuals who are embarking on their journey with recovery. I'm especially thankful for this type of attitude in my town because my husband has been sober for 6.5 years after struggling with an opioid addiction for years. So I thank Nancy and the alumni and recovery team for continuing to bring your message of recovery and grace to so many communities. Thank you to all the presenters and especially to Lieutenant Hurtuk for participating in the event. So thank you.
Awesome. Thank you so much, Erin. You've been a huge asset to helping us bridge with your community and helping us get the walk going. So thank you very much. I just wanted to mention quickly because we were talking about Narcan, and Narcan, for those who don't know, is available at CVS, Walgreens, through the pharmacist. It's covered on insurance. If Al Nadera, who is the director of nursing from Straight and Narrow, was on, he's one of our liaison members, he would do a Narcan demonstration. And that is just yet another thing, that one of those things that we just want to keep aware. We want to keep practicing. We want to have a repetitive understanding of such things because we all never know how we might be able to help somebody. And, it's just a very important time for that. So we're going to go on, and it gives me great pleasure to introduce Mike Paoello. Mike is amazing. He is the chief clinical officer of addiction services at Bergen Newbridge Medical Center. And what I have to say, first of all, I used to work at Bergen Newbridge. I worked as a nurse at Bergen Newbridge for many years. Before it was Bergen Newbridge, it was Pines, it was Bergen Regional back when I was working there. And I know it well. And I loved working addiction services there. I would constantly be between the F1 unit, and I'd walk over and, meet the patients that were going to come from detox. So I spent a lot of time in the services, and I have a great respect for everybody that works there, because they work really hard. They have 100 beds. They have 60 detox beds, and they have 40 rehab beds. And they work tirelessly, extremely hard. And I'm sure Michael will give you all the stats of how many people have gone through there. But I also just want to say that the team, and I know that Deb Visconi might be on this presentation as well, her passion and her care, and wanting to embrace the services that we have to offer by bridging the community with Bergen Newbridge. She welcomed us right in. And she also has, she's also very much brings in the Black Poster Project, which is our sister organization run by Dee Gillen. And I can't thank Bergen Newbridge enough for, creating this open feeling so people can get to know Bergen Newbridge better, because it's got a lot of great resources, and it's on great grounds. If you've never walked it, you should walk it. So with that, I'm going to give you Mike Paoello.
Hi, Nancy. I want to thank Nancy, thank Morgan, thank the officers, and a special thanks to the prosecutor, because it is such a pleasure to work with law enforcement and the prosecutor's office when they have a genuine passion to really want to help. I remember, like, during the crack epidemic, the thinking was just arrest as many people as you can. And so you hear the expression, we can't arrest our way out of this problem. And I kind of seen it when that didn't work. So it really is a pleasure to see the other side of law enforcement, how they are often the first line of defense, which I'll talk about in a minute. I want to begin by talking about the services we have here at Bergen Newbridge. It's a pleasure working at a hospital where we have a full continuum of care. I mean, that is unusual, where we have our detox, we have the inpatient units, short-term rehab, we have outpatient programs, intensive outpatient for adolescents and adults. And we really are stigma-free. We're barrier-free, I like to promote, and that's of critical importance during an opioid epidemic, is that when somebody is ready, that moment when they're ready, yes, I'm willing to get help, all right, maybe very brief. And so telling somebody you can come back, your appointment is in 2 weeks, it could be the difference between life or death. So we are barrier-free access, and we are definitely stigma-free. And stigma-free, why is that important? So Nancy sent out an article yesterday. I figure I had to stay, so I might as well read it. But one of the headlines in the article was, "Stigma is what kills people." It was a UMass article, and it's so true. I mean, there's no law enforcement. Why I say it's of critical importance is law enforcement, and why they become like really the first point of contact is because of the stigma. People often don't want to get help, because when you're looked at often by many people as you don't have willpower, you're just making bad choices. And unfortunately, like, some sort of crisis has to occur. You've heard the term hitting bottom. And typically that crisis and that hitting bottom is going to involve, an arrest or police officers. And seeing how during this epidemic, that actually becomes a point of contact where they're going to help you, as opposed to just focus on arresting you. And without that, I mean, as bad as this epidemic is, I can't imagine how much worse it would be. And the stigma is there. There's nearly 200 people dying every day of an opioid overdose, and yet we still have that stigma. People just focus on, as I say, the scars of the addiction, and not really the person, the heart of the person trying to get help. When I look in our waiting room, and you see these, I always say kids because they look so young, and you see these kids. If you asked them 3 years ago, what would you like to be doing, when you're 25? None of them would have said, I'd like to try that Bergen Newbridge detox. I hear that the food is good. I mean, it's just not something that they ever planned on doing. So it is a disease. Yes, they're responsible for their recovery, but the choice to become an addict is not related to a lack of willpower. So Operation Helping Hand, we spoke about that a few times. I remember meeting with the prosecutor, probably it feels like 10 years ago now. And he had recommended this Operation Helping Hand. I don't even know if we had a name for it at the time. And I thought this was great because I'm constantly trying to look at like, what are different things we can do, really thinking outside the box. And he said, when they're going to buy drugs, we're going to catch them and we're going to offer them treatment. And I said, wow, that's great. So you're not going to arrest them, you're going to get them help. And he said, no, I'm a prosecutor. I'm going to arrest them and then offer them help. I said, well, that'll never work. And fortunately, I was very wrong, and he was right. And so Operation Helping Hand took off. We learned a lot from the first operation. A lot of things went wrong, and we continued to do it. And now it's become really a statewide thing, like in all 21 counties. And I'm glad I was part of the initial stages of that. So back to stigma. If people with Operation Helping Hand and we're offering people help, think about, like, I contrast that with, I know when I first came to Bergen Newbridge back in 2012, the Bergen Record used to always run this front page article. It wasn't even an article, it was mugshots of these kids that got arrested buying heroin. And so they put their mugshots on the front page. And I'm thinking that really didn't motivate anybody to get help. And so to now see, like, moving just from that in Bergen County, putting their mugshots on the front page and that stigma associated with that, to offering them help and not, trying to make it look like they're bad people. So they're often, I work with them every day. They're good people with a bad disease is what I often say. So that was the wall of shame versus Operation Helping Hands. There's a big difference. Recovery specialists, I'd like to talk about that. That's relatively new to the field. It's 10 years ago there was no such thing, and so people would come to treatment, and you can address that stigma by really treating them like with respect, but there was still that missing link. A counselor can't say necessarily, I've been where you're at. So to have a recovery specialist who can self-disclose, hey, I've been where you're at, I know what this feels like. And incorporating them now into our detox, into our rehab services has really, it's been an amazing impact on our what's called AMA rate, which is people leaving before they complete treatment. Often it just takes somebody to come in and say, yeah, I know what you're feeling, I know what you're going through. So that has been like really, really helpful. And then partnerships. The biggest difference with this epidemic that, yeah, it's sad that I'm so old, I can compare the crack epidemic to the opioid epidemic, but it is what it is. And the community partnerships, that is something that just did not exist. Everybody worked in silos. The community partnerships is really where it's at. This is where you see the biggest change. And I think of things we're doing with Nancy. I don't know, we might be ending this call and Nancy's coming to run a yoga group or a meditation group or a recovery group in the recovery center, which has become like the hub for families that want to talk about addiction, for people that are considering going to treatment, and just for community partners. And I think that's really, really important. During the pandemic, we had something called hospitals and institutions where Narcotics Anonymous or Alcoholics Anonymous, the speakers would come in and they would bring meetings. And we don't really have that opportunity now. So having partners that can come in and speak to the patients and bring in other people that can speak to the patients has really helped fill that void. So some of the things that we do as partners, and I'll end with this, is I'm thinking about the Black Balloon Day coming up, and that's on March 6th. And I would love to change that, make it like April 6th, because we're doing it in person. But March 6th is recognized nationally as a day where people remember their loved ones that are lost, were lost to an overdose. And while that's sad, the way we're going to do it here at Bergen Newbridge, and me, Nancy, D. Gillian, Donnelly, our vice president of marketing, we really arranged for it to also instill hope. So we're going to have the Black Poster Project, kind of lining the walls leading down to the auditorium. And for those of you that are not familiar with the Black Poster Project, it's really a poster of a loved one that was lost, and it really celebrates their life on this poster. So as you're walking down the hallway in the auditorium, we're going to have speakers that are in recovery, and so that they can talk about hope. And as I often say, hope is really the foundation of recovery. So I'm looking forward to doing things like that. And it's really educating the community. And these are all things, these partnerships that will make a difference. Okay.
Wow, thanks, Mike. You were talking about during the pandemic too. What did you keep your doors open during the pandemic at the hospital?
Yeah, so we did. It was not the thing to do. I cannot take credit for that. That was entirely Deb Visconi. You know, you spoke about her. Yeah, we can applaud. Deb, I went in with a speech. Everybody, everywhere you looked, every outpatient in Bergen County closed down. And, you know, Deb definitely is a supporter of behavioral health and addictions treatment. But I just thought that there was no way, you know, I'd be able to keep the outpatient open. So, you know, I went in basically with a PowerPoint, thinking I'd have to convince Deb, you know, can we keep our doors open? And Deb, like, I wasn't in there for a minute, and she said, I actually wrote it down. We are a safety net hospital, and we're in the business of helping people. So of course we are going to keep our doors open. And that was, I mean, it was inspirational because I was so afraid that, you know, knowing that connection is the opposite of recovery. And for people that were coming here to now have to stay home and be in front of a computer, I just knew with addictions treatment that was not going to work. And for Deb to support that and allow us to keep our doors open, I can tell you, I can't, how many patients were just thanking us that they had a place to come. And, you know, unfortunately that wasn't really the thing to do at the time. Everything was moved to telehealth, but we did it. And thanks for asking, Nancy. I'm glad that we did.
Oh, yes. And since Deb's on, maybe she'll just say a couple of words real quick. We'd love to hear from you, Deb.
Hey, Nancy. Hi, everybody. So I've been on the meeting the whole time, and I have to tell you, you know, every time I participate in one of these and hear the words and the comments and the stories, it really just makes me so proud to be part of it. First of all, Nancy, thank you for being an incredible partner, an incredible supporter, and organizing these types of events. They are so extraordinarily important. The partnerships, you know, Mark Musella, thank you for your support. The officers that spoke, you guys really fill me with hope that together we can end this epidemic. And make no mistake about it, we are in the middle of a significant epidemic. You know, I often say when I speak that this is the epidemic within the pandemic. You know, we're so focused on COVID and you know, getting out of the COVID pandemic, but truly this has been an epidemic that has no boundaries, knows no borders. And as many have said tonight, you know, it crosses all socioeconomic backgrounds, race, color, gender. It affects everyone. And, you know, at Bergen Newbridge, as you heard Mike say, you know, we are incredibly committed to ending this, to partnering with our community, to make sure that we end this epidemic once and for all. And we have absolutely barrier-free access. We are here to be a resource, educators, partners, and of course, providing extraordinary clinical care for those who need it. So thank you for the opportunity. Thank you for the partnership, and a real huge hats off to Mike Paoello and his team for being relentless advocates in this war. So thank you for the opportunity.
Thank you, Deb. And I'm hoping that we get to see you at Black Balloon Day as well. That would be great on March 6th, which is a Sunday. We're pretty much going to have, I think, it's between 10 and 2 o'clock. And we'll have more about that later in social media. Please pay attention to our site and Bergen Newbridge's too. So, yes, and thank you, Mike, so much. You do so much good. Every time I've ever had somebody that's needed help, because I've had so many people reach out to me because they know my role as you know, in having worked the addiction field so long and in alumni recovery, that that, you know, where can I find help? And, you know, when they need help, I reach out to Mike, and he's always like that. He's just like, he's always so thoughtful. He really, really has such a good heart. And, you know, everybody at Bergen Newbridge that runs these departments, and Deb Visconti too, you can tell it's just really trickles down. Thank you. So with that, I just want to say a couple of things. And again, thank the prosecutor so much, and our police departments that come on and participate in this. And we're going to keep this going. And the next one will be on March 17th. We do it every couple of months, and we always record them. You can always go into our YouTube library, to Alumni and Recovery's YouTube library, to find it and share it with others. It's a great resource. Let's face it, we get so much information from this. I just wanted to say, there's the prosecutor. If you can look at the screen, he's speaking at the last walk we had, and he said he would come back. And if you could save the date, we are going to have another walk to remember. It's an addiction awareness and recovery walk at Westvale Park in Westwood, New Jersey on Sunday, April 24th. And that'll also be from 10 to 2. This is no ordinary walk, mind you. This is a walk that is full of displays. It has the complete Black Poster Project will be there, as it was when we first started. But Dee Gillen has about 400 posters right now. And we have many other displays too. High schools can get involved. We just want to bring the community together. And these are the ways that we can empower ourselves. We don't have to, you know, just feel that we can't do anything. And we can end the stigma by working together. And again, just finding ways that we can get into action. So this is a great way to get involved. And also we have coming up, just so you know, a community event. It will be at Park Ridge High School. And in the evening, the Black Poster Project will be there in their gymnasium. And it will be a community event. And anybody that wants to come and see the Black Poster Project, tell your friends. And by all means, oh, and the police will be there. They're doing a Not Even Once program at Park Ridge High School as well at that time. And we encourage you to reach out to Dee Gillen she is the Black Poster Project creator. She's on this call, but I know that she'll just let me go ahead and speak. And this is just something to be seen. And we can certainly set it up in any school. And we would be happy to do that for any school community that wishes to have us come on in and help. And that is pretty much our program. Again, if you want more information, just go to our website. We thank you for coming on. And I once again want to thank all of our speakers. And please join us again next time, and always share our events with others. That's such a great way of being in action around this disease process. We can recover our world. So let's continue to do what we're doing. Thank you so much, everybody.